Hello, and welcome to another episode of Omnia Fit. This is Kate here, and I have a fellow dietitian with me once again, Michelle Routhenstein, and she is a dietitian specializing in heart disease and heart disease prevention. So, welcome, Michelle. If you want to kind of introduce yourself and talk a little bit about what you do in the relation to heart disease and nutrition.
Yeah, thank you so much for having me. I'm so happy to be here. I'm Michelle Routhenstein. I'm a registered dietitian nutritionist, a certified diabetes educator, and a preventative and cardiology dietitian. And what that essential means is that I take the science-based nutrition and I merge it in with the individual's lifestyle to decrease their risk of cardiovascular disease and heart attacks and strokes. My clientele, I would say, is divided into two types of people. One are people who've had cardiac events, whether that's a heart attack, cardiac bypass surgery, a stroke, a cardiac incident, and now they're looking to prevent a second heart attack or a stroke, or to really optimize their cardiovascular function in order to live a better quality of life and a longer life. Then the other group of people are people who know they have risk factors and they know that they are at risk for heart attacks and strokes, but they want to be as proactive as possible so they can prevent it. And these are people who might have high blood pressure, high cholesterol, fatty liver disease, gout, diabetes, abdominal adiposity, really any risk factors. And I love working with both individuals, but really making people aware about the science-based nutrition and the understanding of what this means. What are some foods that can actually optimize the blood vessel, and what are foods that can hurt or negate or make the arteries more stiff and lead to heart disease. And so really merging that science together and making it accessible and making it a long-term game plan so that people can live a long life.
Yeah, and so when did you realize that you were really passionate about this particular group of clientele?
I've been a dietitian for over 12 years, and when I was in my residency at NYU, I was going through everything from kidney clinics to the ICU to surge units to weight loss clinics, really looking at everything. And what was really center is that there were so many people having heart disease or heart attacks, and it was a really crazy moment, an aha moment when I realized that everyone is kind of looking at one organ at a time or one goal at a time. And we really need to connect all of the dots in order to really prevent chronic disease. And when you look at the statistics, I mean, heart disease is the number one killer globally. And we've seen in the research that 80% of that can be preventable through science-based nutrition and lifestyle medicine. So then why isn't it? And this is kind of where I was like, you know what? I don't think it's accessible. That's one. And two, I don't really think people understand their risk. Most people come to me and say, if they had a heart attack, they're like, Michelle, I I work out. I think I eat healthy. Like, I don't understand how a heart attack happened to me. But when I do my thorough assessment, there are a lot of red flags. And I think that it's just that awareness, that lack of awareness, or that lack of patient advocacy of knowing your numbers and knowing what are the risk factors for heart disease and taking that control. So that's really where I come in to increase awareness and make things accessible and understandable to my clientele and to individuals, and also then to implement science-based nutrition where we're really addressing blood vessel health. Right? If your blood vessel health is not optimized, you're not going to have good blood flow to your kidneys, to your liver, to any organ in your body. And so we need to ensure proper blood flow for optimal chronic disease management and prevention.
Yeah, and I feel like we all kind of have this picture of what someone who has a heart attack fits the description of, and you kind of said right there that so many people are surprised when they come to you after having a heart attack or a heart event and they never saw themselves in this position. Can you kind of go into, the variation of people that you see and sort of what those factors were that led to them having a heart attack or being diagnosed with heart disease that they had no idea were already present?
So there's so many different kinds of groups, and so I never like to say that, everyone kind of thinks of that old man that gets the heart attack.
Yeah.
There's a Heart disease plagues women very early and also much more differently than men. I've seen women who are normal weight, who are underweight, who are overweight. I've seen who've had heart attacks. I've seen people who are CrossFit runners, who are active cyclists, who are marathon runners have a lot of heart attacks as well. So I always like to say that weight, while it is a risk factor for heart disease, is actually not the strongest risk factor. It's one of probably the weakest risk factors. That's A. I've also seen a lot of people who've had a family history of heart disease, or people who actually were adopted and didn't know their family history of heart disease. But when we look at their labs and we look at their lipoprotein A, it's really, really high, which is an indication that they have inherited risk of heart disease. But they didn't know to look for that. I've seen people as young as 30s have a heart attack. I've unfortunately seen people whose parents had a heart attack and didn't make it, and now they're nervous. They have their own kids and they don't want to fall through that again, too. So I see it all, and it's really important that we don't just judge based on how someone looks, that, oh, they're free, they don't have any risk factors. Heart disease, the risk factors for heart disease are so many and so complex that we really need to look at it from a whole standpoint, and also understand that heart disease is a progressive disease, which means that we've seen atherosclerosis, which is that plaque formation in the arteries, in kids as young as 8 years old. So we know that it can come from years and decades of someone's life and then present itself. And if you have a genetic inherited risk, it might present itself early at the age of 30. If you don't, maybe it'll present at 50 or 60, but your blood vessels can accumulate with that plaque and then cause a blockage later in life, or at a certain stressful time period in your life, without you really recognizing of what might be the trigger, because it's not just that one meal that you're consuming. It's really about the years and decades of your lifestyle that you've been leading.
Yeah, and I know you talked a little bit about having sort of two sets of clientele, one who have already found out that they have heart disease or they had a heart event, and then the others who are really focused on seeing you for prevention. So those ones who see you for prevention, what kind of triggered them to want to come see you? So was it a family event? Was it lab work that they got done randomly? Sort of what inspired people to make that step to know that they have to prevent this?
I would say there's a big group of people who don't want to be on medications, or people who've been on medications and they've had bad side effects, or people who've been on medications and their blood pressure is still high, or their cholesterol levels are still high. So they usually are feeling a symptom, or it's that they get a CAC score, which is a coronary artery calcium score, and that is above 0, which is an indication that there's plaque in the arteries. So there's some indication that, oh, wow, I am at risk and I need to be proactive. So it's really dependent on the motivator and the person. It also could be a lot of people are proactive when they know they have a family history of heart disease, because it is scary when your family member passes away at such a young age and you don't want to live that statistic. So being proactive has different motivators in different people, but I would say a large majority is medication intolerance, or the fact that they don't want to be on medication their whole life. And a lot of physicians will, once they prescribe you a heart medication, they keep you on that for a long period of time, and they'll just keep adding and adding unless you also implement diet and nutrition. I also really like to stress the importance of, even if you're on a statin, even if you're on a high blood pressure medication and your numbers are normal, you should still be implementing science-based nutrition into your lifestyle, because you can't outdo a bad diet. Those medications can put a Band-Aid on it. They're not going to address blood vessel health the same way as what we're actually putting inside our body.
Yeah, can you elaborate a little bit on the medication that people typically get prescribed and sort of how they function, just in case any listeners are really unfamiliar with something like a statin?
Yeah. So I mean, there is the statins, which are really helping to clear out the cholesterol production, or the cholesterol synthesis. They can make LDL come lower, but they don't necessarily remove or help with the endothelial lining or the actual ability of the blood vessel to be optimized. And so we need to improve the natural pathways that your body is supposed to do in order for blood vessel health. So we need to look at the nitric oxide pathway through food. We need to look through the glutathione pathway through food. We need to look at different pathways and those vitamins and minerals that the medication is not necessarily going to do. The other thing is the blood pressure medications. A lot of people are on a cocktail of medications, and there's a large group of people who are resistant hypertension, which generally means that you're taking 3 medications and your blood pressure is still elevated. And this is a sign that there is other things going on in the blood vessel that we need to address that the medication won't do. And so we need to always pair them together. And oftentimes with my clients, the doctor will actually remove or reduce the medication that they're on when they're implementing the diet changes.
Yeah, so let's say that someone who's listening, maybe they have had a parent who had a heart attack, or they have a history of heart disease and they kind of don't know where to start. What would you sort of say is the first few steps? Is it to talk to your doctor first? Is it to get your lab work done, then go see a dietitian? Kind of where do you like to see people start that journey of preventing heart disease?
So if you have a genetic history or a known genetic history, meaning that anyone in your close family members had a premature heart attack under the age of 65 years old, or just everyone in general should really know their lipoprotein A numbers. You need to assess your inherited risk of heart disease. So knowing that number, going to the doctor, going to your cardiologist. If your family has a family history of lipid disorders, so they have familial hypercholesterolemia, then you need to do even a more advanced lipid panel, and you might want to see a lipidologist. In order to really get a good handling of that. And then once you get all of that information, you can have the discussion with your cardiologist, but you should also, with your cardiologist, have that as a really important relationship. As needed, you should add in the qualified dietitian who can also address heart health from a nutrition and lifestyle perspective in order to be as proactive as you can be.
And when you talk about the 2 different types of clientele that you have, does your advice differ at all when you're working with someone who has already had a heart event versus someone who is on the prevention end, or is it very much so universal advice that everyone can sort of benefit from in terms of heart disease?
It's actually very personalized. So the way that I look at it is in my first 90-minute assessment, I'm asking a lot of questions about my client, and I've already looked at their labs. I've already looked at their medications. I've already looked at all the supplements that they're taking. So I have a good handling of what that looks like. And then I'm assessing for, is there insulin resistance? Is there inflammation? Is there oxidative stress? What is causing the person's goals to not be achieved? And that's where we address it. So some people who have a heart attack, for instance, have a low ejection fraction. They have heart failure. Other people who have had a heart attack don't. It really depends on how quickly you respond to the heart attack. If you're at home waiting hours and hours, which many times happens, the likelihood of you going into heart failure is much higher. Your heart is going to be weakened at a much quicker rate. If you have gone to the hospital immediately, your risk of heart failure is not as high. So that's one differentiating piece, for example, that would differentiate my advice and which one we would what we would tackle most and how we would look at it. I'm also assessing for gut health and heart health. I'm assessing for vitamin and mineral deficiencies. 10 out of 10 of my clients have a vitamin and mineral deficiency through food. And while some people are very heavy on the supplements, a lot of the supplements have fillers and junk in it that would actually harm the blood vessel and cause more inflammation. So there's so many pieces of the puzzle. So no one gets the same plan. No one gets the same universal advice because everyone has a different culprit that's kind of offsetting what's going on. So it's really looking at everything and kind of connecting the dots and then creating a roadmap for my clients to be able to pull it all together in an effective way that's easy, realistic, seamless, and able to be a habit and behavior change for the long term and not just, the time that we're working together.
Yeah, and I think that's such a great description of what seeing a dietitian, how that differs from seeing any other health professional or talking to Google searches about
Google's the
how to,
worst.
yeah, about, a condition, especially a new diagnosis, the value that we have in being able to read lab results and know what medications do and know how they work with supplements. I think that's just such a good call out of how advanced and personalized care we can provide as dietitians, versus what maybe people picture us giving out a leaflet about the heart healthy diet, because a
Oh,
lot of people don't
100%.
know sort of how advanced and personalized we can make care.
Exactly. I mean, the thing that drives me crazy is when someone tells me that they left the hospital after a heart attack and they got literally a sentence in their discharge paper that says low salt diet.
Yeah.
That's like literally maybe a little bit of like anything we discuss. Like low sodium is not going to change your heart health. It's
No.
not. So we've seen the literature sodium alone doesn't really impact cardiovascular disease as much as what else we're pairing it with. It is a part of the puzzle, but it's not the only thing. And I feel like that's really all they're given about what not to eat. And there's so many foods we need to add into the diet to allow for therapeutic value and to allow for optimal cardiovascular health.
And what are some of those foods that sort of surprise your clients when you tell them are so much more important than the low sodium that they've heard about before?
I mean, there's so many different ones, but I would say, hmm, a surprised food. I mean, I don't know if people get necessarily surprised, but I break it down in terms of, I think this thing of eating more fruits and vegetables is fine, but which fruits and vegetables? So, for instance, in the nitric oxide pathway, there's only about six foods that have nitric oxide that gets converted when we consume them, and those are spinach, cabbage, garlic, beets, and arugula and radishes. And so, I could say eat more fruits and vegetables, but if you're only eating one type or you're only eating one thing, it's not necessarily giving you those benefits. So I think some people are a little shocked by that. And I feel like people also are not very understanding of the way everything kind of balances together with needing the carbs, the protein, and the fat, and not just eliminating one of those. I feel like especially in heart disease, a lot of times either the fat group's eliminated or the carb group isn't eliminated, and those are really essential components to a heart healthy diet, but also to allow all your body to thrive. We need all of those macronutrients, and to just remove one of them is going to lead to many deficiencies that will negatively impact the heart health.
Yeah, and I feel like that's also such an old misconception that's around, people think they have to take out salt, they have to take out fat, and that will heal it, right? Because that's sort of the messaging, that in the Cheerios box with lower your cholesterol with Cheerios, is
That's
sort of the only messaging that we kind of publicly have ever gotten about preventing heart disease through diet.
Yeah, and there's so many people who reach out to me and say, Michelle, like I don't eat red meat, and I don't have much salt. I don't know why my cholesterol levels are still high or why my blood pressure is still high. And I'm like, well, it's probably because you're not adding the therapeutic foods you need to lower cholesterol and to lower blood pressure. And it's really about what we're adding. It is about reducing some of the foods that will increase our cholesterol levels, but how do we get rid of the cholesterol levels if we're just eliminating foods? We really need to add in all those binding foods that also help to excrete the cholesterol as well.
Yeah, and how do you see activity sort of play a role in that as well, in terms of what sort of activity recommendations you're making to go hand in hand with the food changes?
Yeah, so that's also something that needs to be personalized. So I see people on a very large scale of things. I see people who are very sedentary, not necessarily because they want to, but maybe because they have heart failure, they have shortness of breath, they have swelling, they have medically indicated reasons for not being able to be physically active. And then I have people who are CrossFit runners. So I have who are very, opposite sides, whether they're no exercise or over exercise. When we look in the literature, the middle ground of, regular physical activity is important, and all types of activity are important, but we need to understand where the person's coming from. If somebody has heart failure and their ejection fraction is 10 or 15, I'm not really going to ask them to be doing a 45-minute run or walk or bike because their heart can't handle that. So I basically we personalize the exercise to allow the person to be able to do it and not overstress their heart, but strengthen their heart. A lot of times people are doing cardiac rehab alongside either my group programs or my individual programs, and that allows us to also merge both of them together really nicely. So it really depends on where they are, and then getting them to the standard that we can do for consistency, right? You can do anything maybe for a couple weeks, but what are you doing for the rest of your life is really the biggest question. I really want you to be able to implement these things, not for the next week or two, but really for the next, 5, 10, 15, 20 years or however long, we can.
Yeah, and I know that you mentioned at the beginning as well that you also are a diabetes educator. How often do you see those roles overlap with clients?
100%. So a lot of times, sometimes people will go to me, you're a diabetes educator, like, aren't you cardiology? I'm confused. They're correlated. When you have high blood sugar levels, you're causing inflammation and insulin resistance in your arteries. What's going to happen? Plaque's going to build up, LDL is going to build up, it can cause constriction, it can even cause heart failure, it can cause high blood pressure. It's all in the blood vessel. So they are very, very correlated. People who have high blood sugar levels are at a 2 to 4 times higher risk of heart disease. This was the population that when I was in my training was a lot of diabetics or people who've had glucose intolerance, and you could see the correlation directly there. And a lot of times diabetes shows up 10 to 15 years after you've had insulin resistance. So it's something that your body's been brewing for a while. So I do a very big assessment to see if insulin resistance is part of it, even if you don't have diabetes. So it's a big part of my assessment and allows me to really address the blood sugar role in heart disease with all of my clients. So I use it all the time, whether I have diabetic clients or I don't. And I'll just be honest with you, not most of my clients don't necessarily have diabetes. A lot of them do, some of them do, but it's really something I practice all the time because it's part of the whole assessment and part of the whole risk reduction from a whole person approach to ensure we're really checking all of our boxes.
Yeah, and I think this has been so much great information, even just for the average person who maybe doesn't know yet if they're at risk of heart disease or hasn't asked their family members what sort of family history they have going back. So for a listener who is taking this in, what is like the one takeaway that you would really want them all to listen and take away to implement into their life?
I want you to be proactive in your health. I've seen too many times after someone's had a heart attack or a cardiac event, 10 years of high cholesterol levels, many years of, oh, you just have white coat syndrome, don't worry about it, when in fact they've had high blood pressure. That's led to a high CAC score. I've seen so many times that people who've kind of ignored it because they didn't feel the symptoms, and then it lead to a cardiac event. So I want you to know your numbers. I want you to understand them. And I'm not saying, you need to be a dietitian or a doctor, but ask questions. Be an advocate for yourself because nobody else is going to be. And so know your numbers, know your risk, and be as proactive as you can today so that you can live the life you want to live without having to worry about your health and chronic conditions going.
Yeah, and to close out, what would you kind of say is the biggest inspiration or motivation that you've seen for early intervention, early prevention, and sort of what your outcome can be if you do sort of take charge of your health as quickly as possible and as early as possible?
I mean, we've known in the research that 80% of heart disease is preventable through science-based nutrition and lifestyle medicine. We need to be not just taking anecdotal information, not following just like trends like the keto diet, really getting your information from sound nutrition, and knowing that it's been backed up that we can reverse this global statistic of heart disease being the number one killer if we're proactive and really looking and implementing positive heart healthy change today and every day going forward.
Yeah, I think that's such a great piece to leave people with. And just the power of taking control of your own health is such a big piece of advice for everyone in every different situation. So thank you so much for that. And this has been so informative, and I think people will have learned a lot.
My pleasure. Thank you for having me.
Thank you.